So many of us, you know what, we're working from home, you know what, we're able to watch from their office, wherever we may be. Well, guess what? They can and they are. Dr. Stephen Lester is a cardiologist with Mayo Clinic to explain just how this technology is working. And first of all, welcome back to Sonoran Living. I'm so happy to see you. This is a fascinating subject today.
Thank you. Glad to be here.
Okay, I know we're both kind of sick, so we're going to be okay. But let's talk about, Dr. Lester, how this program all came about. It's because of two doctors that you know on how you're able to monitor patients at home. Give me the backstory here of how it started.
Sure. So there are two doctors. I don't know if there's a picture maybe of them, but there's a father and a son. And the dad, he has the clinical syndrome of heart failure.
Okay.
And so they came to see me in my office to try to figure out a management plan for Dad's heart condition. And Dad, see, he would spend his winter months with us here in sunny Arizona. And during those months, his son could keep close tabs on his dad's health status. He was close to his healthcare providers, and he did quite well. But in the summer, he wanted to go back to his home in Quincy, Illinois, where he raised his large and beautiful family. And when he'd go back home, his son wasn't really right there to monitor him. He wasn't as close to his healthcare providers. And at times, Dad's health status would deteriorate. And he'd end up sometimes in an urgent care center or in an emergency department. So we wanted to find ways where we could monitor Dad's health status from a distance so we could feel comfortable that Dad's health was in check even when he went back to his home in Illinois.
And you have done just that in a way that is extraordinary. And this story is so familiar to so many people who have parents who are, you know, have heart failure. My mother is one of them, but still feels her independence and need to be independent. We want them to be. You've come up with a bunch of devices here, one that we just saw in the reveal a little bit earlier. But on the table here, you have a blood pressure cuff, a scale, a exercise monitor, and then another device that you all attach to your smartphone. What is that telling you as a physician?
Right. So we can begin to monitor various parameters of your health or a patient's health, whether it be their weight or body composition. These are wireless Bluetooth-enabled blood pressure cuffs or activity trackers. You saw in the reveal the ECG coming across, where we can monitor the electrical signals of the heart. And all that information is placed in a dashboard where you can see it as a patient. You could follow your mom's data if your mom is not near you, or it can come to the healthcare providers, and we can begin to follow some of these parameters of your health.
And here's the thing. So, for example, on the scale, what is the scale going to tell me as you know, as I'm watching, you know, what my mom is doing from afar? If her weight goes up, what does that tell me?
Right. So when people have heart failure, what happens is that they begin to retain water. And so if you weigh yourself every day, I sort of liken it to the way diabetics monitor their blood sugar and they change the amount of insulin that they take each day. We can put people on a scale, we can weigh them. And on day one, let's just say they weighed 150 pounds. And the next day they weigh 151. And then the next day, 153. And their weight's quickly going up. They're not gaining weight that quickly because of, you know, gaining fat. They're gaining too much water. And perhaps we need to change some of their medications to take some of the water out. So we can detect changes in their health status even before they develop symptoms, and we can intervene and keep them out of our hospitals and urgent care centers.
Yeah, and that's exactly the point here is intervention and monitoring them in such a way. As a physician, can you then work with them if you detect that there's a potential problem? You know, they've been maybe increasing in their water weight gain, or their blood pressure is not as normal as it should be. How do you help them from that position?
So we create, really, for these patients, truly a care management team. It's a team-based approach to managing care. So we have physicians and advanced practice providers, we have social workers, dietitians, motivational interviewers, exercise physiologists, and so the dietitian
could call up and say, you haven't been eating right.
That's right. So the father here, that goes back to Quincy, Illinois, you know, he would eat a lot of perhaps salty foods and soups and easier things, and we didn't really recognize that until we actually had the dietitian talk to him and recognize his diet had changed and it was just causing problems for him.
And then real quickly, and that's what I love, is this team approach. And there's actually a symposium coming up that you're inviting the public to. What will they learn when they attend?
So when the public attends, they'll be able to meet a number of the physicians and care providers at the clinic. They'll learn about some of the medications and treatments that we use, some of the techniques that we can monitor the patients perhaps from a distance. and to begin to ask questions about how to manage their health.
Yeah, take control of your health, and it's a team approach, as always. Dr.
Yeah.
Lester, thank you very
you.
much. All right, let me tell you, if you need some more information or you need to schedule an appointment with a Mayo Clinic cardiologist, here's the number that you call. It's 480-301-8200. You can also learn more at mayoclinic.org. We don't want you to forget that ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we'll give you easy-to-follow recipes and ideas to help keep you and your loved one's heart healthy. To learn more, get our Rally for Red reminders, sign up at abc15.com/rallyforred.